Welcome to another episode of Hometown Hotspots. I'm Tim with my brokerage. Today I'm at Stout Wellness in Peachtree City, and I am super excited about this because she is a functional medicine doctor, and you are not going to meet anyone more passionate about medicine and health than she is. Let's check it out.
I'm Kristen Oja. I'm a doctor of nursing practice and a nurse practitioner. I have my certification through the Institute of Functional Medicine, and functional medicine is really my bread and butter, which we will get into. But I am the CEO and founder of Stout Wellness, which is the nation's first medicine and movement practice. I work with my husband and my sister, and I have a 2.5-year-old and a 1-year-old. So it's so nice to meet you guys.
So I've known Kristen for several years. How long has my wife been working with you?
I would say now it's probably 8 years. Maybe even more.
My wife claims that she's the secret to her youth. So this is one reason we're here. We've been friends with her and her family for a while. So this is your third location.
Third location. And I have to say, though, Christy is like the dream patient. So just a little Christy.
Does whatever she's told.
She does.
Unless I tell her.
Work, I know.
If I tell her, she don't listen.
Yeah.
So I'm just going to have you tell.
Yep.
Okay.
But it is our third location. We have in Atlanta was our first one. We opened in 2019. Then we opened Roswell in 2022. And then we opened here in 2023.
Okay.
Peachtree City.
So how long have you been open in Peachtree City?
We opened officially in April. So we're like just coming up on 2 months.
Okay. Okay. And what's the address?
We are 3015 State Street.
Okay.
And don't ask me the zip code.
30269.
There you go. All right. Thanks for filling in the gaps.
Okay. So the main part of your practice is functional medicine. My interpretation of functional medicine is you treat the core problem, you don't treat the symptoms.
Yes. That is exactly right.
Tell me about that.
So we've really come, like if you think big picture as a healthcare system, we've really moved into more sick care. We take a very reactive approach. So if you come in with a symptom, we react to it and we give you a medication or a treatment, right? So if you come in with depression, here's an antibiotic. And that's kind of how the conversation goes. And in certain times, that sick care is very important. I always say, like, if you need surgery, if you are in the ER, if there is an emergency, that's phenomenal. I'm glad we have this sick care. But when you're looking at becoming the best version of yourself, or maybe you're like, I want to know why. I wasn't depressed my whole life. Like, why am I depressed? Why am I bloated after eating every single meal? I don't like this diagnosis of irritable bowel syndrome, right? And we have some of these kind of broad diagnoses that cover up when we really don't know what's going on. And that's where functional medicine comes in, and we say, okay, let's take a deeper dive. And so if you even look at our logo, it's a W, and there's a triangle in the middle, and that's the mind, body, and spirit. And there's a gap, meaning there's room for improvement in us all. So I always talk about our patient population is on the continuum. We have the really, really sick that aren't getting answers in conventional medicine, and they feel horrible every single day. And we're like, okay, let's figure out what's happening on a cellular level. And then we have the people over here that do every single thing for their health, right? The Christy, like infrared sauna, cryotherapy, all of it. But they're like, I want to know how I can be better. Like there's always a way I can be better. And that's where we kind of fall all along the continuum. But it is root cause. So if you have a migraine, we want to see, is your cortisol high? Is it a magnesium deficiency? Do you have sleep apnea and lack of oxygen to your brain? And we want to fix that or help heal that versus just managing it.
And I think modern medicine is equipped now. They just treat the symptoms because it's immediate and there's very little effort. That makes sense?
Well, yes. And I think that's really because, and that's why we're a cash pay practice, because when you look at the insurance model, their reimbursement is based on like a 5 to 10 minute visit. A lot of times, like you have to document a ton to bill at a higher code for reimbursement. So primary care specifically, they're in a really tough spot where they're seeing 20 to 40 patients a day. And if you're going in seeing 20 or 40 patients a day, you only have time to give them a quick fix, right? Like you don't have time to talk about what they're eating. And we see this, and I love gastroenterologists, but we see this even when we refer to GI, that they've never asked the patient, what are you eating? Because their system is not set up to have the time to do that. And obviously, if you're eating 3 times a day, 4 times a day, what you're putting in your mouth is the most important thing when we talk about gut health. So we can't bypass that. And that's where functional medicine comes in. So our new patients are an hour, our follow-ups are 30 minutes. And then of course, there's all the work after that on treatment plans and, making sure patients know what to take and when and what lifestyle changes are going to have the largest impact.
I remember the first time I saw you years ago, it was like you did blood work and you did the food allergy test.
Yes.
And we discovered I was allergic to chicken and eggs.
Yes.
And that is something I ate daily. Like I eat a dozen eggs every other day.
Yes.
And I'm now, it's been probably 3-4 years. I can start eating those again.
Yes.
just not as often.
In moderation, exactly. And when you talk about food sensitivities, it's pretty complex because there's so many different elements, right? There's like the gut component. Is your gut healthy? How are you reacting to the foods? How often are you eating the foods? So like we see this a lot where people once a year will do a food sensitivity to find out like, okay, I've been really loving blueberries. I'm eating blueberries every day. How's my body responding? And they're like, okay, blueberries is a moderate sensitivity. I'm gonna back down on that and start incorporating in some raspberries and strawberries. So we know variety is key. Nutritionally, it's key. Seasonally, it's key. But then seeing it on paper is really important. I think that makes a big difference for people, is like seeing chicken and eggs. Like you would never cut that out if you didn't do the test. Absolutely.
Well, you're trained to think that's healthy.
Yep.
So when I come in and you do the blood work probably mostly everybody, and you followed up with like, okay, you need to do this vitamins and you get me on a regimen. Now, from what the blood work and the regimen, how do those two correlate, and what's the importance of that type of treatment?
So we're very data driven, because like I love subjectively how you feel, your improvements, but sometimes some of these things are more on a cellular level, right? Especially when you think of prevention. So heart health is a big example, or nutrients that play a role with detoxification. So if you're lacking B9 and B12, you may not notice that from day to day. So tracking levels is very, very important. And then there is a deeper thing in functional medicine. So like normal is not okay always. So like, for example, vitamin D, the reference range could be 30 to 100. You could be 31 and you're normal, but that's not optimal. So we'd want to put you on a vitamin D, and then we also want to recheck. We don't want to just throw you on things to have you on things. And at Stout, we really like to take a minimalist approach. Like I would love my patients to take like 5 or 6 supplements and kind of move them in and out depending on what's going on in their life, because we're supplementing a healthy lifestyle, right? So the data helps us really take an individualized approach along with subjective information that you're telling us. And then we want to track the progress. And one of my favorite things is inflammation, for example. You don't feel when you're inflamed a lot of times. Low-grade inflammation is so vague, but it's such a driver of heart disease, Alzheimer's, cancers, autoimmune disease. And so we can see, okay, your CRP came back, and this is not Tim's, but it came back at 6, right? And I'm like, okay, 0 to 10 is normal, but you're walking around with all this inflammation. So then we start you on a plan and we repeat, and we're like, now your CRP is 3. We cut that in half, which is decreasing your risk of chronic disease. And that's why we love marrying data and symptoms together.
Because of your treatment plan, I'm putting together that it takes more effort from the doctor and the patient. Is that true?
So definitely, functional medicine takes a lot more time on the patient and the provider. So I always tell our providers, like we see on a really busy day, 12 patients, on a more normal day, probably around 8 to 12 patients a day. And I always tell my providers, you have to love what you do, because you are knowing everything about patients. You're living through the trauma that patients went through. You're living through the grief of divorces. You're living through the loss of a child with them. So I like to say that we're basically counselor meets functional medicine providers, because we get to know our patients in such depth. And then the visit is only a small piece of what we do. It's so much of the work afterwards of, sharing labs with our patients, doing their treatment plan. Each treatment plan probably takes us 10 to 20 minutes to do on top of their visit, plus the questions that they have in between visits. But I know for me, I can definitely speak into a lot of our team, is we're so fulfilled by the work we do. And I'm sure you feel like this a lot too. When you end your day, even if you've been working hard and there is a lot more effort that goes into functional medicine, you're having a bigger impact. And so it's that purpose. It's that purpose that I just deeply love, that it motivates me to keep working hard every day.
Is it fair to say that people that are not willing to do the work are going to see less of a result from this type of treatment?
Absolutely. And I tell patients, functional medicine on both ends is not easy, right? So as a patient, we're going to expect some lifestyle changes. My favorite saying is little by little, a little becomes a lot. So it's sometimes very simple things we start with. So we'll have some patients that just don't eat protein. Our first goal is, let's start eating protein. We're talking through some different protein options, ways you can balance your meals. So we really want it to feel attainable. The last thing I want is for someone to come to Stat and leave feeling like I have to change my entire life overnight, because they're not going to be consistent either. And we want to encourage that I succeeded. So little by little, a little becomes a lot. But yes, you have to put the effort in. I always tell people, we can't out-supplement, we can't out-injection a really unhealthy life. So to me, when I look at some other functional medicine providers' plans, and it's like lifestyle's not addressed at all, and here's 20 supplements that you need to take, that's not actually getting to the root cause either. So I always say we do functional medicine, but we really do lifestyle medicine.
Okay, you're talking about little by little. It's like small hinges swing big doors.
Yes.
The littlest thing can make the biggest difference. So So you've covered what functioning medicine is and what you guys do, but I know there's more than functional medicine here.
Yes.
What else do you provide?
Yeah, so we really like to claim that we're a one-stop wellness shop. So we have health coaching, we have dietitians, we have personal trainers, we do group fitness, small group training, and then we have physical therapy, which is a really big thing. Because of us doing medicine and movement, that movement component is so important for longevity. And we spend a lot of time talking about joint longevity. So we don't want to just be throwing around weight and injuring ourselves or wearing down our joints. Like, we want to work on stability, we want to work on strength, and we want to work on power, all combined.
Yeah.
So all of our programming is designed by physical therapists, and we put a lot of emphasis on performance-based PT. How can we recover faster? How can our golf swing? How can we have a better range of motion? So we do dry needling, cupping, Stout Wellness movement screens. We created our own movement screen that helps with longevity. So we really marry medicine and movement, and we're a one-stop wellness shop. And IV therapy, like you're getting right now.
So with the IV, what is this IV?
So this one is called a Replenish. So it's basically a multivitamin. So you get vitamin C, you get magnesium, you get methylated Bs, you get some calcium, and you get fluid hydration. So we have a whole slew. We do glutathione IV pushes. We do NAD, which is great for longevity and brain health. We do high-dose vitamin C, which is great for post-viral load, cancer, along with treatment if you get sick. We do really high, like 25, 50 grams for the right person. We also do recovery, which is amino acids. We have a whole slew, and it's all on our website under treatment. So if you want to check it out.
Okay, so I can come here, I can have group fitness, I can have a physical therapist, I can have IV treatments, and I can have a functional medicine doctor, all working together to get me to my goal of being the best me I can be.
Yes, and we think about that functional medicine provider at all of our locations as your quarterback within Stout Wellness. So they help you figure out, okay, you need to do a movement screen, you need to see physical therapy. You really need health coaching. Like, we need to really start with health coaching and behavior change. So they're your quarterback that helps you navigate all of our services. So you're not lost when you come in of like, what do I need, what do I do? We recommend starting with a new patient functional medicine visit and allowing them to be your quarterback.
Awesome. Is there anything you want your new community of Peachtree City to know about your business?
I think it's maybe less about the business, but more about them, as life is too short to not feel your best. And so I always tell people that your health is your greatest wealth. And, you know, even if you feel good now, you're investing in your future. So, like, what is your why? Is where I would leave them.
So where can we find out more about you and Stout Wellness?
So if you're looking for Stout Wellness, our website is stoutwellness.com. Our Instagram handle is @StoutWellness, and on Facebook, we're just facebook.com/Stout Wellness. If you're looking for me personally, or you want to see more pictures of my little girls, it's Dr. Kristen Oja, Dr. Kristen with an I-N, O-J-A.
I love it. I appreciate your time.
So good to see you.
Good to see you.